In this video, we will cover two topics. First, where to place all ECG lids. And second, how these well-placed lids magically converts into 12 lids ECG. Let's start with lid placement. For that, we will need 10 lids, which is of two types. 4 lids for limbs, and 6 lids for chest. These 10 lids will give us a 12-lid ECG. These 10 lids are 10 electrodes. Out of these 10, 4 lids are attached on limbs, and other 6 lids are attached on chest. Red lid will attach to right hand. Green lid will attach to left leg. Black lid will attach to right leg. And yellow lid will attach to left hand. In chest lids, V1 is attached at right side of sternum, and at 4th intercostal space. V2 is attached at left side of sternum, and at 4th intercostal space. V4 is attached at mid-clavicular line, and at 4th intercostal space. V3 is attached between V2 and V4. V6 is attached at main axillary line, and at 5th intercostal space, and V5 is attached between V4 and V6. So this is how the all 10 lids are placed. Now let's see how these 10 electrodes magically converts into 12 lids ECG. Twelve lids are actually 12 different point of view of heart from 12 different angles. We will learn this with Einthoven's triangle. Okay, so we have 10 electrodes. One is on left leg, second is on right leg, third one is on right hand, and fourth is on left hand. These 4 electrodes will form 6 leads. According to Einthoven's triangle, there is an imaginary line going from right hand to left hand. So the electrical impulses from here and electrical impulses from here, which will go to our clever ECG machine, which will in return gives us the lid 1. Lid 1 is a first lid in our 12-lid ECG, and it is a bipolar lid, as it uses 2 electrodes to form. So the lid 1 gives us a view of heart from above direction. Now we have second imaginary line, going from right hand to left leg. So electrical impulses from right hand electrode and electrical impulses from left leg electrode combines and forms lid 2. So lid 2 is also a bipolar lid. And it gives us a view of heart from this direction. The third imaginary line to finish the triangle will go from left hand to left leg. So the electrical impulses from left hand electrode and electrical impulses from left leg electrode forms lid 3. Just like lid 1 and 2, lid 3 is also a bipolar lid as it uses 2 different electrodes. And it gives us a view of heart from this direction. So this is the Einthoven's triangle. And one thing you guys must have noticed, that in the process of forming this triangle we have totally ignored the electrode of right leg. Because the electrode of right leg is just totally unearthed, as it has no specific use in making of an ECG. It is just there to finish the process, and gets completely unearthed. So now we have 3 bipolar lids, lid 1, lid 2, and lid 3. And 3 active electrodes. Electrode of right hand, electrode of left hand, and electrode of one leg, which we call foot. The lid AVR of ECG is formed by the electrode of right hand, and it is an unipolar lid. Because it is formed by just one electrode. AVR stands for augmented voltage right, and it gives us view from right hand side. The next lid in 12-lid ECG is AVL. It is another unipolar lid formed by the electrode of left hand. AVL stands for augmented voltage left, and it gives us view of heart from left hand side. And the third unipolar lid is lid AVF. AVF is formed by the only leg electrode, which we call foot. AVF stands for augmented voltage foot, and it gives us view from bottom of the heart or inferior side of heart. So Einthoven's triangle gives us 3 bipolar lids: lid 1, lid 2, and lid 3, and 3 unipolar lids: lid AVR, lid AVL, and lid AVF. These 6 lids are called limb lids, and the other 6 lids called chest lids. These are V1, V2, V4, V6, V3, and V5. These 6 lids gives us a view of the heart from the front. So the limb lids gives us a view of heart in this plane, and the chest lids gives us a view of heart in this plane. Let's take few examples to understand this better. If the patient is having inferior wall infarct, then there will be ST changes in lid 2, lid 3, and lid AVF, as these 3 lids are facing heart from the inferior side of heart. In such cases, it is more likely that right coronary artery of heart having blockage, because right coronary artery mainly supplies the blood to the inferior part of heart. And if patient is having anterior wall infarct, then there will be ST changes in chest lids like V1, V2, V3, V4, V5, and V6. In these cases, left atrial descending artery of heart is having blockage, because LAD supplies the anterior part of the heart. If patient having lateral wall infarct, then there is most likely ST changes in lid 1, lid AVL, lid V5, and lid V6. In these cases, there is more likely chances of left circumflex artery of heart to have blockage, because LCX supplies the lateral side of the heart. And if patient having posterior wall infarct, then there will be ST depression on the chest lids like lid V2, V3, V4, and V5. We can't apply lids on back of the patient, so when the posterior side of heart is involved, there will be ST depression on chest lids rather than ST elevation. In the cases like dextrocardia, when the heart is on right side, these lids are applied in completely reverse formation. Thanks for watching the video till the end. Please like the video, and if you are new to the channel, don't forget to subscribe for more such videos. And leave a comment if you are having any doubts regarding to the video.